Thanks very much for inviting me to speak today. So I'm going to be talking about the Needle Exchange Surveillance Initiative, and we recently finished, I'll explain more about what the study is, but we recently finished one of the sweeps, which we wrapped up just in December of 23. We're working on publishing the results, so some of what you're seeing today is kind of hot off the press. We're putting it together for a report that we produce after every sweep. So Public Health Scotland will be publishing that, and I'm required to say that this data is effectively kind of embargoed until that report comes out. So keep an eye out for the report, which will be coming out in July or August. So yeah, what I'm going to talk about is, I'll explain what NESI is. Some of you may have heard of it already. I'll talk about who participates in NESI. And then we'll start looking at trends. So trends in drugs injected, trends in drugs smoked or snorted or ingested, and we also get information on injecting risk behaviors and injecting related harms. So there's a number of injecting related harms that we can measure in NESI. So what is NESI? So it's a national survey. And by national, we mean it goes across all the mainland health boards, so we don't cover the island health boards, but all across mainland Scotland, covering all the boards. It's cross-sectional, which means we sort of just go in once, we don't follow people up, and it relates to people who inject drugs. So we recruit at sites that provide injecting equipment. So most of you will know that mainly constitutes pharmacies. Pharmacies is where we do the majority of recruitment, but there's also other agencies. And of course, all these places often provide other interventions, OAT, naloxone, etc. So it's not just injecting equipment, but the requirement is that they have to provide injecting equipment. And to be eligible to participate in the study, you have to have injected drugs at least once in the past, but ideally we want to aim for 70 to 80% of people who have injected in the last 6 months, just because we're more interested in people who are effectively currently injecting. And we've undertaken 8 sweeps of NESI to date, so going back to 2008-09. And the latest one, as I said, it took place in 2022-23, just because it takes us about a year to get around all the health boards, and we wrapped up in December 23. And notably, this is the first sweep post-COVID. So 2019-20 sweep happened just before COVID, and in fact we had to wrap it up a bit early because face-to-face research was banned. Pulling that closer to me. So we didn't really know what happened during COVID, so this is the first sweep post-COVID, which has given us a lot of useful intelligence on this population. So what does NESI involve? So our interviewers go out to the services where we recruit people, and they go through a questionnaire with the person. So I've said participants complete a questionnaire, but it's in fact the interviewer that takes them through the questionnaire. And this is meant to be a picture of an interviewer, but our interviewers tend not to wear suit jackets and shirts, so it's a little bit less formal than that. And the questionnaire asks all sorts of things about injecting behaviors and uptake of interventions, that sort of thing. And then the interviewer will take a blood spot sample. We try to get 5 dots. The samples are sent to the West of Scotland virus lab, where they're tested for hepatitis C virus, so HCV, and they're also tested for HIV. In the past, one particular sweep we tested for Hep B, but we've only done that 1 year. Prevalence was really low, but we might be looking to do some Hep B testing again in the future, and I'll talk a little bit about that as well. So the lab data comes back to us, and the questionnaire data we have, we call that the self-report data. So we don't collect people's names as part of NESI, so we use a code. A code goes on the questionnaire, a code goes on the blood spot sample, and then that's how we marry things back up for analyzing them. So moving on to some of the results. who participates in NESI in terms of their age and sex. So the graph on the left shows the age group distribution of NESI. So it's going back, each bar represents a NESI sweep, so looking back to 2008-9 up to the latest sweep. So I don't think this will probably be a surprise to anybody in the room that we're picking up an aging group of people here. So we had about 12% who were aged less than 25 in 2008, and in the latest sweep we've got about 3%, and now in the latest sweep we've got 18% who are aged 50 plus. So definitely some evidence that is consistent with this hypothesis of the aging cohort. And in terms of sex, it's pretty stable. It's always been roughly 3/4 male, 1/4 female, which is very much reflective of, I believe, who's coming into those services. So we also ask people when they first started injecting, and that's the blue bars in this chart. And so that has usually hovered, it's been more or less the same across all the sweeps. So it's hovered around 23, 24 years old. So it suggests, again, it's that we're picking up an aging cohort. So these are people who started in their early 20s and are getting older. And the orange bars is the time since they first started injecting. So again, consistent with the aging cohort, we've got an increase in that with the latest sweep. So this is the average injecting career, if you like, is 17 years, which is a fairly appreciable amount of time. So looking at trends in drugs injected in the last 6 months, and what I should stress here, so this is self-reported. This is different to what Jason reported. This is what people think they're getting. So we don't actually know what is in these drugs, but this is what people think they're purchasing. So the blue, we never used to show heroin on this graph because it dwarfed everything else in the past, because all the other things were kind of bubbling away at most 10%. But as you can see, and it probably won't be a surprise to anybody, cocaine injecting has increased fairly dramatically. So we've got, in the latest sweep, 64% of respondents report injecting cocaine. So I suspect that this chimes with people's experiences in the services, and in NESI we're able to quantify it, and it is a fairly dramatic increase. And correspondingly, we're seeing heroin injection coming down slightly. It was always, 97% or so in the previous sweeps, and now down at 72%, which may relate to the street availability as well. And the rest of the drugs that people report injecting in the last 6 months are fairly low prevalence. You can see a little blip related to legal highs in 2015-16, but that hasn't carried on because of the legislation that was brought in. So this slide relates to, so people can say any number of drugs in response to this question, so that's why they don't add up to 100%. But if we look at trying to, how heroin and cocaine combine together, some people will inject these together, some people will only inject one. So you can see in the blue, those who've reported injecting heroin only in the last 6 months has dropped fairly dramatically, so with 33% reporting only heroin injection, 23% reporting only cocaine injection, and then the gray and the yellow bars are those who inject heroin and cocaine, both of them. So the yellow relates to, I just separated those out for interest. So the yellow relates to injecting them both in the same hit, which is sometimes called a snowball. And then the gray relates to injecting both of them together, but not in the same hit. So injecting them both but at different times. So 41% in total report injecting both heroin and cocaine. So there's a fair bit of overlap there, and you can see how that proportion has increased over the years. So we also ask what is the main drug that you injected, so they can first list all the different drugs that they've injected, but we ask people to focus in on what their main drug of injection is. And this is fairly consistent, so down at heroin is still the predominant one that people report injecting as their main drug, but only slightly. So in 2022-23, about 50% versus 40% who report injecting cocaine as their main drug, and small amounts reporting injecting other things as their main drug. So looking at polydrug injection, and some of the increase in cocaine injection will likely be driving this increase in polydrug injection. I haven't shown it here, but when we stratify this by whether people have reported injecting cocaine or not, people who inject cocaine are more likely to report injecting more drugs. So we can see in blue the proportion who just inject one drug has dropped fairly dramatically to 54%, and those who report injecting two drugs or more has increased from 11% back at the very start of NESI to 43% in the latest sweep. So an increase in those reporting polydrug injection in the last 6 months. So in NESI we also ask about whether people smoked, snorted, or ingested drugs in the last 6 months, and it's important to remember that this is still related to this population of people who inject drugs. So we're not talking about people who haven't injected and are only smoking, snorting. This is very much smoking, snorting, or ingesting drugs among people who inject drugs. So we've only asked this question in the last 2 sweeps. So it's not exactly a trend yet, but we can certainly compare the 2 sweeps. So the bar over on the left is just whether anybody has smoked, snorted, or ingested any drug in the last 6 months, and that shows a slight increase. But you can see also it's very, very prevalent for people who are currently injecting drugs to also be taking them via these other routes, with 84% in the latest NESI sweep. And then if we look at the drugs that people reported smoking or snorting in the last 6 months, in the middle part of the graph there, a lot of them are fairly prevalent. You've got a fair bit of heroin, 38%, cocaine 31%, crack 45%, and half of people reporting smoking cannabis. And it looks like for all those drugs there's been a bit of an increase in smoking or snorting needs since the last sweep in 2019-20. And in terms of drugs ingested, so taken orally, so you've got your benzos, which are obviously the most prevalent. Looks like perhaps a slight decrease in those reporting orally taking benzos since the last sweep. And then the second one, although it's a lot less common, was gabapentinoids, which includes gabapentin or pregabalin, with 8% reporting and taking those. Again, this is the drugs that people think they're purchasing, so not necessarily what is in these drugs. And in the other bars, it tends to be a mix, just a handful of people reporting a number of things, so you can't really group it up into any categories that have any appreciable numbers in them. So moving on to trends in injecting risk behaviours, and I'll be reflecting a bit on how the increase in cocaine has potentially been driving some of the risk behaviours as well as some of the harms. So this one was actually a bit surprising to me. So we look at how frequently people report injecting in the last 6 months. So over on the left, you've got the whole sample of people who reported injecting in the last 6 months, and given the very clear upward trend in cocaine injecting, I would have expected to see a similar parallel trend in frequency of injecting, because you have to inject cocaine more frequently to maintain your high. And this isn't what we're seeing here. It's definitely not going up, and maybe even some suggestion that it's lower than in 2019-20. perhaps this measure isn't quite sensitive enough and we need to dig into this a bit more. But then you can look at it by whether people have reported injecting cocaine or not. So you've got in the middle part of the graph those who hadn't injected cocaine in the last 6 months, and then on the right you've got those who had injected cocaine in the last 6 months. And you can see that the proportions on the right are generally a bit higher than the ones on the left. So for example, in 2022-23 you've got 40% among those who hadn't injected cocaine versus 52% among those who had injected cocaine. So some suggestion there that those who do report cocaine injecting are injecting more frequently, but it doesn't seem to be driving an overall trend in frequency of injecting. So looking at self-reported sharing of needles and syringes, that was 15% in 2008-9. It kind of looked like it was slightly trending down up to about 2015-16, and it's swung up a little bit, and it's hovering at 11% who report sharing needles and syringes in the last 6 months. Sharing other paraphernalia, so this includes cookers, filters, water, so that certainly declined from 2008-9, and we're seeing that kind of hovering at 20-25% in the last few surveys. And so finding trends in injecting related harm, and also reflecting whether cocaine is driving any of these trends that we're seeing. So this is self-reported soft tissue infections. So we asked people if they've had redness, swelling, pus, abscess, that kind of thing at their injecting site. And again, this one I found slightly surprising given the increase in cocaine injection. I thought we would have seen a sort of corresponding increase in soft tissue infections. And it's certainly higher at 27% than it was in 2019-20, but it doesn't look like a consistent upward trend. But if we do stratify it between those who report injecting cocaine, which is the green on the right, versus those who don't report injecting cocaine in the last 6 months, you can see it is definitely higher among those who report cocaine injection. Was through. This is perhaps a little bit of a clearer picture. So this is again self-reported. We asked people if they have overdosed in the last year. It looks like that is trending slightly upwards, with a quarter of people saying they experienced an overdose in 2022-23. And again, if we stratify this by cocaine injection, it's appreciably higher among those who had reported cocaine injection in the last 6 months. And then pivoting slightly to the bloodborne virus realm, just looking at trends in harms. And while hepatitis C HCV virus infection has been associated with cocaine injection in the past, there's a lot of other things that are driving the trends in hepatitis C. One of the main things being now the availability of a very effective treatment to clear the virus, which has massively been scaled up. We just weren't sure what was happening with regard to treatment during the pandemic. So it's a good news story in the sense that the prevalence of hepatitis C hasn't gotten any worse, so it hasn't gone up during the pandemic, but many of you may be aware of the Scottish government's target to eliminate hepatitis C as a public health threat by 2024, which that was obviously announced before the pandemic, and the pandemic came along, and that has perhaps slightly delayed those targets. But you can see in the light blue there we've got 4% chronic hepatitis C prevalence in Tayside, 17% in Greater Glasgow and Clyde, and 16% in the rest of Scotland. So it hasn't gone up, which is the kind of positive message coming out. And in Tayside, where they've massively scaled up treatment, they're on track for elimination in Tayside. So that's good. And moving on to HIV infection. So we know about the association between cocaine injecting and HIV infection, so work that colleagues have done in the past. Andy Macaulay and Kirsten Trainer has shown that there is, if you're injecting cocaine, you're much more likely to get HIV. And so this is the latest data. So the light blue bar on the right is the 2022-23 figures. So again, we didn't really know what was happening with HIV during the pandemic. Certainly HIV testing had gone down, but this is similar to hepatitis C. It's a good news story in that it hasn't increased. So there doesn't appear to have been an increase in transmission of HIV during the pandemic. So that's good. So Glasgow, in particular, I haven't separated out Glasgow city centre from the rest of GGC here, but the HIV epidemic was always focused mainly in Glasgow, and that latest prevalence of HIV is 4.2%, and in the rest of Scotland is 0.7%. I've got a couple of minutes left. And I mentioned that we hadn't tested for Hep B in the recent sweep, and so this isn't exactly a harm, but it could potentially become a harm because this is just looking at hepatitis B vaccination in this population, and it does appear to be trending downwards. So we've got 52% who report having been vaccinated, and we define that as at least one dose of the Hep B vaccine. And so that's 52% in the latest sweep. And if we look at that by, we stratify that by people who've been injecting for 5 years or less versus those who've been injecting for a longer time. And the point of this is because we want to catch people, we want to vaccinate them very early on after they start injecting, so that we can prevent Hep B, rather than potentially after they've acquired it, the vaccine won't be as effective. And so particularly among those who have been injecting for 5 years or less, it does appear to be a fairly dramatic decline in the uptake of hepatitis B vaccination, with 29% in the latest sweep. So this is potential for future harms in terms of hepatitis B potentially, and most people receive their vaccinations in prison, and I haven't showed this here, but if we look at vaccinations in prison, they're definitely dropping off as well. So there doesn't seem to be as much vaccination happening in prison as there was in the past. So just to summarize, the 2022-23 sweep was the first sweep since COVID pandemic, so it's given us a lot of useful intel on what has happened since the pandemic. So we've seen this dramatic rise in cocaine injecting. Smoking, snorting, or ingesting drugs is very prevalent among people who are currently injecting. So despite the increase in cocaine injection, there doesn't seem to be evidence of an overall increase in injecting frequency or other injecting risk behaviors, although people who inject cocaine are more likely to report a lot of these risk behaviors. Some evidence of an increase in self-reported harms, so non-fatal overdose, and higher rates of soft tissue infection compared to 2019-20. Progress towards Hep C elimination slowed somewhat during the pandemic. As I showed, HIV prevalence doesn't appear to have increased, but risk factors are still prevalent. So overall, it's a good, not a bad picture in terms of some of the harms, but what I would say is that a lot of the risk behaviors are still there, and so the potential for an increase in harms is very much still there. And that is that. Just to say thank you to all the NESI participants. We very much appreciate their participation, the NESI project team, the NESI interviewers, all the services that very kindly let our interviewers in to bother all their clients, and the NESI steering group. Thank you.